Hello everyone, how are you all on today? My name is Dr. Merlindy Brown. I'm a registered nurse, family nurse practitioner, and doctor of nursing practice. And on today, I will be talking about nursing school and how hard it really is. Is it hard? Is it not hard? Is it easy? What should I expect? So we'll get into all of that on today. So first and foremost, I want to thank you all for joining the channel on today. I know that there's so many different like nursing related videos and nursing content that's out there on YouTube. So the fact that you chose to stop by my channel on today and just kind of listen to what I have to talk about and have to say, just want to say that I greatly appreciate it. If you are new here and you haven't already subscribed to my YouTube channel, I ask that you would please do so. I would be so appreciative of you for doing that, and you can just do that by hitting the subscribe button below. Also like the video as well if you like the content. If you're interested in this type of this type of subject matter, please like the video. I greatly appreciate that as well. So we will get right into it. So is nursing school hard? That is the $1,000,000 question, right? A lot of people, a lot of individuals are, thinking about nursing school. They've had friends that have, went to nursing school. And so the question is often thrown around, like, is it hard? Is it something that I can do? And I think there's this kind of idea that, yes, nursing school is hard, right? But I want to just give my perspective on that particular question and kind of let you know what I'm thinking about it. So I actually do get that question quite frequently. I work in a primary care setting and I work around individuals that are medical assistants. There are a lot of medical assistants and I think they're interested in nursing school. And so they will ask me the question, like, is nursing school hard? Like, do you think I can do this? And I always chuckle whenever I get that particular question because it's not really an easy question to answer, because depending upon who you ask, you'll get a different response. I feel like the majority of people are going to say yes, but I always say that no, nursing school isn't hard. And let me back up by saying this: like, everyone has a different cognitive level, right? Everybody has a different level of intellect. There are some people who can study for an hour and they have the material down pat, right? There are some individuals who have to study 5, 6, 7 hours, then they have it, right? So people's intellect and their cognitive ability, cognitive status, their ability to learn is very different. So that's why I always say it's not really a clear black and white answer. But going back to my response to that question, I say no, that it's not hard from a standpoint of, like, I feel like the content is something that you can grasp. I feel like that you can read a medical surgical chapter in a medical surgical book. It's not the easiest to read, but I feel like if you spend time on it and you actually, and that's, of course, that's any subject matter, but of course I think med surg is probably one of the more challenging, I guess you could say, classes that you would take in nursing school. But I feel like if you sit down, if you read, I'm a person of average, cognitive ability. If you sit down, if you read, if you truly study, then I feel like it is something that can be grasped by the individual who has, an average, level of intellect, average, cognitive status, average cognitive ability. Definitely. I feel like the more appropriate question to ask, and I don't really think people know that they need to ask this question, is nursing school intense? And my answer to that question would be absolutely yes. I don't think people are really ready for the intensity level that comes along with a nursing program. So, like, for instance, with me, I am, before I went to nursing school, I completed my first nursing program from 2011 to 2012. So prior to that time, I went to the University of North Texas, and I completed 3 years of undergraduate school, as well as 1 year of graduate school in a psychology program. So I was used to going to class Monday, Tuesday, Wednesday, Thursday, right? Like a Monday, Wednesday class or a Tuesday, Thursday class. And I would have exams maybe like twice a semester, right? You have your midterm exams and then you have your final exams, right? And that's pretty much it, right? And you have that for maybe 3 to 4 different classes. And so, you have, and mostly, especially in undergraduate, you have more so exams. So when you get to graduate school, you have papers, right? So I remember writing like 30, 40, 50 page papers in graduate school. I'm like, fine, right? No problem for me in particular. But when I went to nursing school, it was a completely different ball game. And it wasn't from a content standpoint. It wasn't from like, oh my gosh, this is hard material. It's like, oh my gosh, there's so much thrown at me, right? So like usually a person's gonna attend school from on Monday, Tuesday, Wednesday, Thursday, and Friday, right? Either Monday through Thursday or Monday through Friday typically. And then typically the first 2 days, maybe not the first 2 days, but 2 days within the week, there's just lecture only, right? So you're spending 8 hours a day, 7 to 8 hours a day just in lecture, right? Learning about nursing related contents, whether it's gerontology, whether it's medical surgical nursing, whether it's pharmacology, whether it's mental health nursing, whatever the case may be, whatever the curriculum is. You spend about 7 to 8 hours for 2 days out of the week, just dedicated to doing that. And then the other 2 days out of the week, if it's a 4-day per week type of program, the other 2 days out of the week, you're actually going to be in clinicals. So depending upon your program, you may be in an 8-hour clinical, you may be in a 10 or a 12-hour clinical. And so that comprises the other 2 days, right? So typically 2 days in lecture and 2 days of clinical. Well, that's a lot of time, right? That's a lot of time that's out of your week. That's 36 to 40 hours out of the week that you're spending either in clinical or in the classroom. Well, you have to study, right? Sometime as well. So oftentimes when you get home, whether it's on Monday, Tuesday, Wednesday, Thursday, or Friday, when you get home, you have to dedicate some time to studying, and then you have to study on the weekend as well. If you want to be successful as a nursing student, you're going to have to dedicate some time to actually studying. And then you have exams, typically like either every week or every other week, or you have checkoffs, or you have something else that you have to do as it relates to your nursing content on a like weekly or every other week basis. So I think what people are not they don't realize, especially going into nursing school, is how intense it is. There's so much to be done. There's a lot of curriculum to learn. There's a lot of clinicals, and then there's very little study time because so much of your time is actually in school that you have to dedicate either the evenings or the weekends to studying. And a lot of people, like me personally, I've never been a big social person as far as like going out. Like I don't go out much, so the fact that I had to dedicate a lot of time to studying was nothing for me. That was right down my alley, right? But the overwhelming majority of people that I know are very social, right? Social butterflies. They want to do something every single weekend. And I think a lot of people, when they sign up for nursing school, they don't really realize that this is a sacrifice, right? That I'm not going to be able to go out every weekend if I want to be successful, right? And that means you can't go out and hang out with friends as much or hang out with family as much. And so I think that's where I will want people to really like direct their attention. Not, oh my gosh, can I grasp this content, right? If you study, if you dedicate your time, a person with average intellectual abilities, I feel like they can grasp the information. The thing is, are you willing to sacrifice your time, and are you willing to, endure the intensity that comes along with nursing school? Because it is not like none other. Like I said, I've been in graduate programs at a traditional university, but then going into nursing school was like a completely different ball game because I was just not ready for. And I say I wasn't ready, but I just wasn't expecting it. I put it like that. I did very well by the grace of God. I graduated valedictorian of my vocational nursing program, 3.7 GPA in my RN program. So did very well by the grace of the Lord. But it's about making sure that whenever you walk across that stage, you're walking across as a competent graduate nurse. You may not be a licensed nurse yet. You may not be an LVN yet or RN when you walk across that stage, but you want to walk across that stage knowing that you did everything that you possibly could in order to grasp the content and grasp the information. And so, yeah. So, the answer to the question, is nursing school hard? I would say no, from a standpoint like the content isn't hard. Like you can get it. Person with average intelligence, you can absolutely do it. However, it's intense, and you're going to have to be willing to sacrifice your time, away from family, time away from friends. And I think a lot of people aren't willing to to quite do that. So I feel like once you come to the real, if you're one of those people that are super social and it's a little bit difficult to really, kind of sacrifice that social time, I feel like it's really important to kind of like, okay, make sure that when you apply to school and once you get in, that you are willing to dedicate the time that's necessary in order to be a successful nursing student. So that is my perspective on this particular subject matter. Is nursing school hard? So if you like this video, give it a thumbs up. Again, if you're new here, please subscribe to my channel. I would greatly appreciate it. And tell me your thoughts as well. I'm pretty sure there's going to be a lot of individuals who are either nurses, LVNs, RNs, maybe even nurse practitioners that may watch this video. Leave a comment if you wouldn't mind. Just kind of tell me what your thoughts are. Like I said, I think the better question is it intense? Yes. Hard, like you can't grasp the information. I feel like most people can, but just tell me what your thoughts are and kind of what your experiences were in the comment section. I would love to hear all about it. So until next time, again, I endeavor to come on every single week and provide you with some excellent content. That's my goal. And also remember this, I've always been a person of great faith, and I truly believe Philippians 4:13, it says that we can do all things through Christ that strengthens us. And it's something that I didn't really grasp when I was super young. When I was like in high school, I didn't really have a lot of faith. I'm like, oh, I can do this or I can't do that. But then as I grew older, especially when I went into nursing school, I realized, you know what, I can do absolutely everything, because it's not just me doing it. It's the Lord, and it's Jesus Christ that's working through me, that's giving me the ability to be able to do these things. So if you're a person of faith, which I highly encourage you to be, kind of remember the scripture. That's something that I lean and depend upon all throughout school. Philippians 4:13, I can do all things through Christ that strengthens me. Another scripture that I love as well is Philippians 1:6. It says, but as it is written, he, whatever he starts, he's going to finish, right? He that hath begun a good work in me shall perform it until the day of Jesus Christ. Whatever God starts, if he said that it was meant for you to go to nursing school and that's the path that he has for you to do, he's going to make sure that comes to fruition, that it comes to pass. So pray that you all are blessed. And again, I endeavor to come on at least once weekly and talk about something nursing related. If you have any content in particular that you would like to see me discuss or talk about, please leave it in the comment section, and I'll try to get around to discussing that at some point. So pray that all of you all are blessed, and God bless. Bye-bye.